Respected faculties, I am Dr. Vrinda S Raj. I am going to present a case of Morton's neuroma. Morton's neuroma is encountered as a case of forefoot pain which may limit weight-bearing activities and footwear choices. It is a benign perineural fibrosis of common plantar digital nerve, typically affecting third or fourth intermetatarsal space. Morton's neuroma of the first intermetatarsal space is very rare. So the clinical presentation came as she is a 24-year-old lady, swelling left foot dorsum for 3 years, pain on the dorsum of the left foot while walking. It is relieved by rest and night pain was frequently present. Numbness in the first left intermetatarsal space was present. On inspection, fullness present in the first intermetatarsal space. On palpation, minimal tenderness present. Diffuse swelling of size 2.5 into 1.5 cm present. After the baseline investigation, we proceeded with definitive investigations. X-ray foot was within normal limit. A high-resolution ultrasound was done, but it couldn't give a definitive diagnosis. So we proceeded with an MRI. The MRI report came as hyperintense lesions, first interdigital plane abutting the muscles, 2.3 into 1.5 into 1.7 cm, with perilesional fat stranding, most probably Morton's neuroma. And after evaluating and investigating the case, anesthesia fitness was obtained and patient was and we proceeded for surgical exploration under spinal anesthesia. So the operative findings was incision is a curvilinear incision over the swelling of the dorsum of the foot. EHL and EHB tendons retracted. Dorsalis pedis artery identified, looped, and later it was ligated. Swelling seemed abutting the first and second intermetatarsal bone and common plantar digital nerve. Swelling excised along with the nerve. Plantar digital nerve continuity was re-established using an interposition nerve graft using an adjacent cutaneous nerve. So these are the intraoperative pictures. First picture showing the loop dorsalis pedis artery. Second is the excised specimen, and third one is the nerve grafting picture showing an interposition nerve grafting for the common plantar digital nerve. The follow-up postoperative period was uneventful. Discharged on 5th postoperative day. Sutures removed on 14th postoperative day. The biopsy report came as fibrosis around and within the nerve, Schwann cell and fibroblast proliferation, myelinated nerve fiber loss. The picture was consistent with Morton's neuroma. So the Morton's neuroma was described in 1876 by Thomas George Morton. Not a true neuroma. Fibrosis of the digital nerve is the presentation, and repetitive trauma is the most frequent cause, and third intermetatarsal space is the most common site of the swelling. Clinical test is thumb, index, finger Q's test and Mulder's test. MRI is the investigation of the choice. So in management, you have to avoid high heels and you can use a specially designed orthotic footwears. Some studies are showing corticosteroid injections 2 to 3 doses for helpful in decreasing the size of the swelling and also the symptoms. Other studies showing ethanol injections, radiofrequency ablations, lasers, Botox, but it is usually not recommended. Surgical excision is the treatment of choice and dorsal approach is the most common surgical approach. Recurrence rate is very high, it's almost 30%. Stump neuroma as it's called, and stump implantation into the muscle is advocated in some studies to avoid recurrence. So in conclusion, I presented this case as it is rare to find a Morton's neuroma in the first intermetatarsal space, and also in its management. After excision of the neuroma, we used a nerve graft to establish the continuity of the plantar digital nerve. Thank you.